first takeaway from this is that value-based care is a very important initiative for reducing cost and improving quality for the United States health system. Our second major takeaway is that pharmacists, as well as other providers, should be working with actuaries because we provide a very holistic, rational approach to solving financial problems.
Yeah, I think I completely agree with Joan's points, and maybe just that I think really the key takeaway from some of the examples I'm going to give is that these financial and clinical integrated models are really going to be essential in these value-based agreements. And so they're a great tool to really help decrease a lot of the apprehension around VBAs.
Right now, the United States spends 18% of its GDP on healthcare compared to 11% for comparable countries like the UK, France, and Germany. That sounds like a good deal, but we're not getting our quality. We rank very low, if not the lowest, in most of the health measures for those same countries. Take a holistic approach to looking at problems. We kind of look at the continuum of risk and opportunities and challenges that go along with it. We're particularly interested in risk, which is an important element for providers, the ability to measure the risk.
Part of the issue is that we do have slower than predicted uptake of VBAs. And I think that's in part due to like logistics, as well as a fear of like that unknown financial impact. And so actuarial models can really help with both of these issues. And so actuarial models, I mean, actuarial finance focused, and then input from, the pharmacist or clinical person really regarding clinical areas, so that you come up with these really financial and clinically integrated models. These integrated models can incorporate spend, trend, clinical information, and then they really result in a prediction of utilization, cost. You can look at clinical endpoints of interest like hospitalizations, ED visits, total cost of care, just to kind of name a few. So these reports can be useful in predicting financial impact and really take a lot of the guesswork out of VBAs. And if the model is set up to track progress through those like designated outcomes of interest, the logistics become less of an issue and less of a burden. So I think the models overall can provide much needed visibility to all the involved parties as well. Healthcare business decisions really involve, I think, both clinical and financial considerations, and that's why they're complex. So you really need data tools to support these decisions. And so, pharmacy subject matter experts can work with actuaries to really develop these dashboards or models that have those financial and clinical integration points that I just mentioned a moment ago. And so these tools or models can be used in all settings where VBAs occur. So they can help providers understand the financial impact of the VBAs with payers, and then really help to inform strategy in terms of, highest risk populations to target to bring down that total cost of care under the VBA. The models can help health plans in VBAs with pharma by, elucidating the total cost of care per disease state. And that really helps with like structuring the VBA, and potentially can help with the ongoing assessment and the reconciliation pieces as well. And then, in addition, I think the models can help just support the VBA arrangements or several processes that support the VBAs. So like P&T, initiative planning, contracting, audits, and really I think the models overall are high level takeaways that they're really useful and they're easy to extrapolate. So they really should be integrated in, all parts of the industry in general.
I look at it a little bit more simplistic. If you want to understand the cost and risk associated with a drug, a procedure, whatever it is, you have to understand what that drug does from a clinical standpoint. That is the starting point. if you are putting out a new drug, then you need to understand what risk and cost are associated with it. So the back and forth comes up to the most optimal answer in most cases.
I think that's part of the misconception, I guess, is that these are, you know, it's like total cost of care or value-based care, right? Like our overall arrangement, right? That's been something that you've heard for 10, 20 years, right? So I think the part of us bringing it forth too is that unfortunately it's used maybe in pockets, but it's not integrated into these processes on like a routine basis, right? And so a lot of times, if you were to go out in the market and ask somebody why aren't you doing VBAs? It is truly usually because like the data is concerning, like how will I get this? How will I track this? How do I, I have all these other things I need to do. How do I add this in and have like data that's consistent and good for these, so we can do financial reconciliation? Or, how do I don't know the cost of this. I'll have to put that, it's like a prioritization. I'll have to put that on my, things to do, and whatever's the most important, I'll look at that, but it's not part of the routine processes. And so we're trying to really say, it's not just you only use it for this or this, you really should develop those processes. And that way you can use it across, all the different processes that you do.
Right, I agree. I will only add that value-based arrangements are an extension of what we've done before. Fee-for-service was relatively easy to predict, didn't always do it well, but mathematically it was well. Now you have the added layer of uncertainty with the risk associated with it. Are you going to meet all the quality measures? Are you going to actually be more efficient than your competitors? So there's more things to consider in doing the projections than you did before.
That's true.
And and as Nicole said, the data is not always there, so you have to deal with that uncertainty.